Ever wondered what the difference is between a paramedic, an EMT, and an EMR? You might be surprised to learn that these terms aren't just interchangeable labels for any first responder who pops up in an ambulance. There's actually a hierarchy in emergency medical services, or EMS, that dictates the roles, responsibilities, and training requirements of each position. Picture a ladder. At the bottom rung, you find emergency medical responders, or EMRs. These are the entry-level professionals in EMS equipped with around 60 hours of training to provide immediate, life-saving care to critical patients. They're the first line of defense, proficient in administering CPR, assembling splints, assessing trauma, taking vital signs, and responding to patients experiencing shock or diabetic emergencies. Climbing up a step, we encounter emergency medical technicians, or EMTs. The next level up, EMTs undergo a more extensive training program, typically lasting around 150 hours or longer. They're capable of everything an EMR can do, and then some. From delivering babies to handling fire-related injuries and exposure to hazardous materials, EMTs have a wider scope of practice. Interestingly, you don't need to be an EMR or have any previous medical experience to become an EMT. At the top of the ladder, we have paramedics. They're the most advanced EMS professionals, having undergone between 1,200 to 1,800 hours of training. Paramedics can do everything an EMT and EMR can, plus they're also trained to interpret EKGs, intubate patients, and administer intravenous medications. However, it's important to note that the exact duties and training requirements can vary by state. There are also roles that sit between these major categories, such as the advanced EMT. So if you witness a non-paramedic first responder administering an IV, don't assume they're overstepping their boundaries. So, in a nutshell, the difference between a paramedic, an EMT, and an EMR lies in their training responsibilities and the scope of medical procedures they can perform. From the 60-hour trained EMR to the highly skilled paramedic, each plays a vital role in providing emergency medical services. They all work together in a well-orchestrated hierarchy to ensure that when you need urgent medical help, you're in the best possible hands.